Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, MELDITA'S Info Corner. My Facebook is johnregacho@yahoo.ca. Okay, as I promised before, I will be presenting this time the kidney transplant video. And part 1, of course, will be the normal physiology, the pathophysiology of the kidney disease. I remember a year ago, I presented this glomerular function already, but this is just a brief one. Okay? So we have a simple urinary system here, and we have the left and the right kidneys. We have the renal artery, the renal vein, the ureters, and the urinary bladder. I took a piece of tissue from the left kidney, and we all know that the tissue is composed of many cells. And we have here one kidney cell, which is called nephron, which has the glomerulus and the tubules. And again, I took a piece of a tissue from the glomerulus to present our one capillary filter, because all the capillaries here, a cluster of capillaries here in the Bowman capsule, are all filters. And this is it. This is one single capillary. Okay? So we have here the interlobular artery that receives blood from the renal artery. And that blood will go through the dilated afferent arteriole. Okay, that's the one. And then in here, the actually the kidney perfusion increases, and the resistance of the afferent arteriole increases, and that's to prevent from transmitting the increased pressure to the glomerulus. Okay, and the kidney. So then, as this kidney perfusion goes down and the afferent arteriole relaxes, okay, so there will be back a maintenance of hydrostatic pressure and glomerular filtration. Okay, but the kidney will produce renin, and the renin will produce also angiotensin 2, and that will constrict this afferent arteriole. Okay, just to let you know, this is the Bowman capsule that encapsulates our glomerulus. Okay, so from there, the red blood cell and the protein, which are bigger cells, will go to the afferent arteriole, and it will go to the peritubular capillaries to serve their purpose, and use up peritubular circulation will be absorbed back by the interlobular vein and back to the right side of the heart. Okay, so you're wondering, how about the finer particles? If these larger particles like red blood cell and protein will not pass this filter, but instead collected by the afferent arteriole, how about those smaller particles? Okay, the smaller particles are the following. We have water, electrolytes, glucose, amino acids, the toxins. Okay, so these particles will pass this filter here. So this is one capillary, and this is the lumen of the capillary, and you see that we have holes in here, the fenestrae, and next to that is the glomerular basement membrane, and next to that are the food processes of the podocyte, and in between these food processes, the food processes are called the pedicels. In between them are openings called slits. Okay, and that's where the fine chemicals will pass through. Okay, so how will you make these things happen? How will this filtration work? What is the what are the things here to know? Okay, first, to be able to have a successful glomerular filtration, we have the following criteria. Number 1, be sure that our afferent arteriole is dilated. Be sure that our afferent arteriole is constricted, and that makes up an effective hydrostatic pressure. And this hydrostatic pressure will overcome the Bowman's capsule's hydrostatic pressure. Okay, there we go. So those are the requirements. And the blood pressure is good, and the cardiac output is good. So when do you think our glomerular filtration fail? When will it fail? Okay, where our glomerular filtration will fail if these things happen. The afferent arteriole is constricted instead of dilated. The efferent arteriole is dilated instead of constricted. So they go the opposite way. Okay, so that will give us a lower hydrostatic pressure. So if we constrict our afferent arteriole and we will dilate our efferent arteriole, then we have a low hydrostatic pressure. Then filtration will not happen. Okay, so that will fail. And the pressure here will be higher. And there's another reason why our Bowman's hydrostatic pressure will increase. If there is tubular obstruction, and if we do have, urinary tract obstruction, that will increase our hydrostatic pressure in the Bowman's space, and that will defeat our hydrostatic pressure. Other conditions that will drop our hydrostatic pressures is for instance, we have a low blood pressure, we have a low cardiac output, and there's a poor permeability of these capillaries, and that will be a problem. So to make it effective, as I mentioned, a good filter to work, we have a dilated afferent arteriole, we have a constricted efferent arteriole to make up a good hydrostatic pressure to overcome the hydrostatic pressure of the Bowman's space. Okay, there we go. Now, what's going to happen to these fine particles as they exit the filter, the capillary filters? They will be all passing through here, and they will be all in the Bowman's space. And this is where the start of urine formation. Okay, so what are the elements found here ready to be delivered to the proximal convoluted tubing? We have water, we have electrolytes, glucose, amino acids, toxins, okay, and other things here. They pass through here, the proximal convoluted tubing. They enter it, and in this part, the electrolytes are absorbed, the glucose, amino acids, and the other particles, and there is a secretion of, the bicarbonate is also absorbed, 90%, and there's a secretion of hydrogen ion here. So the water and the toxins, they all proceed, going down the loop of Henle. So at the loop of Henle, there is a concentration of urine here, going to the distal convoluted tubing, where there is further absorption of sodium and calcium. Okay, and here, the ultrafilter continue to proceed to the collecting duct. Okay, so urine is formed, and that will be here. There is an acid-base balance in here. Potassium will be exiting here, coming out here, going to the renal pelvis, to the ureter's bladder, and to the urethra. Okay, so that's about it. Again, to have an effective filtration, glomerular filtration, we have a dilated afferent arteriole, we have a constricted efferent arteriole to make up a good hydrostatic pressure. There we go. And the filter is the capillaries, and we have here